Good afternoon, everyone. It's a pleasure to come back in India. Just to inform all of you, I used to come to India for 25 years. I came in India for the first time as a backpacker, and in 1999 I attended the first conference in Mumbai to do live cases in angioplasty. And at this time, it is true that there was a gap between Europe and USA and the rest of the world, because in Europe and particularly in France, we were among the pioneers to start angioplasty. And I've seen for 25 years that things have changed dramatically. And in India nowadays, you have very good centers. Like here, I've seen, first of all, the facilities have changed in the right way. You have very good equipment, very good cath lab, which is the basis to see the coronary arteries and to work in good conditions. And I've seen also the operators, the young cardiologists, the young generation, increasing their skills and working with the same standard that we use. And I can even tell you that some facility and some hospital in India are like a palace, and comparing to the hospital we have in France. Sometimes the facilities are even much better than in my own center. So I want to congratulate all of you, first of all, for this improvement of the facility, and all the cardiologists now in India, they have attended a major conference all over the world, and they know how to treat the patient. They know all the recommendations, they know all the tips and tricks. Some centers have younger cardiologists, and they also teach each other. This is what we were discussing this morning with the other cardiologists. The role of an old cardiologist like me is to give the knowledge, give the tips and tricks to the young cardiologists. So it's my goal to be here today to share with them my experience, but I can tell you that they have also already the majority of the skills. I've just done more cases than them because I'm older than them, but they have very good equipment and very good skills as well. So we have done already one very complex cases. It looks simply from the beginning, but we know that even a simple case, when we touch the heart, it can become very complex, and so we have to manage how to treat the complication. If we have complication, we have to know how to change the hardware, to use the right one to get a good result at the end of the procedure. So along the case, we discuss all together which catheter we must use, which guide wire we have to use, which stent we have to use, and this is how we improve our skills each other. Because even myself, I still continue to learn from the other place all over the world, how to manage sometimes complications that I didn't get, and some of operators show us some little tips and tricks that they have in hands or in their brain, and they can, of course, even to me, teach how to do that. So if as a media you have some question about, in general, coronary heart disease and equipment, and feel free to ask questions. The equipment, as I said previously, the majority of the cities all over India, I've been in many districts all over India, and I've seen a lot of centers very well equipped with good facilities, very nice and up-to-date cath lab, and also the majority of the hardware which is available in Europe is nowadays available also in India. And I must even tell you that you have probably one of the best stent of the world, which is manufactured in India, that I use in my center every day from Indian company. So now this stent is available in France, and the health authority has given the reimbursement of this Indian stent in France since 3 years, and I'm using this stent routinely because it's very efficient, very trackable. It can go very easily in the coronary artery, and the results are similar than the results published by the previous American stent, which were the gold standard for more than 20-25 years nowadays. So all the new stents are coming mainly from Asia nowadays and mainly from India. You have 2-3 big companies in India which make very good stents. So don't keep in mind that the best treatment are coming from US or from Europe. You have also in India nowadays very good treatment and very good devices to be used for the patient.
What is the style of meditation going on in the cardiac arrest or in the angioplasty department or in those stents you are working?
There is a dramatic change in technology since 25 years. When I came to India for the first time and during the 90s, at this time we have only what we call the bare metal stent. It was just a metallic stent without any medications. And with this kind of stent at this time, the risk of repeat restenosis, what we call reblockage, was very high, between 30 and 40%. Then, from the beginning of 2002-2003, we have now that we call the drug-eluting stent. That means at the surface of this metallic stent, we have a medication to avoid the reblockage of the arterial wall. And nowadays, a lot of companies, and particularly the Indian companies, are making very good stent, with very good properties to go inside the coronary artery, and very good drug to avoid the reblockage inside the coronary artery. So this is probably one of the two major companies in India which are making these stents, which are very effective nowadays in terms of trackability, deliverability, and in terms of efficiency inside the coronary vessel. So definitely in India nowadays, first of all, the infrastructure, the facility are equivalent to the European and even the US standards, and the operators also have really improved their skills and are now able to perform the angioplasty. Of course, we have young cardiologists, but we have also very young cardiologists in France who need more experience, but at the same age, at the same level, you have very good cardiologists able to perform a very good operation, very good intervention, very good angioplasty with very good device, very good stent coming from India.
So, as an experienced, so much experience, what is your guidance to follow for the persons, for the people, or for the younger people of younger Indians, that they should follow to avoid this type of intervention in the future?
Yes, of course. I have a lot of young cardiologists who learned from me, and even I had a fellow from Gujarat during the 90s who stayed 1 year with me to learn angioplasty. So what I can suggest to the young cardiologist is to go in high volume, what we call high volume centers, and to work with high experienced operators. So as my colleague said, in medicine field, we learn from each other. We have to work together. Just looking at the hands of another operator, of a skilled and experienced operator, you can learn a lot of things. And the role of old cardiologists like me is to give the knowledge, to give what we learned years after years to the young cardiologists.
So when are you coming next? In 2024 you have come. So you should expect in 2025 you are coming again, right?
I used to come from India workshop and conference for 25 years, at least 2-3 times a year. Because I have to work in my center also, of course. But I love India. I've always had very well been welcome in India. I've had a lot of friends. I like Indian food. You have also very nice palace, very, very nice place to visit. Apart from the Cat Lab, I like to go to Rajasthan and to south of India, also in Kerala. It's a very nice place also to visit. I've been there many places. So I hope to come back as soon as possible.